Yeah, we can go into the dining topic. What do we have up on the screen is just the decontamination procedure that the fire department has established for its HAZTAC units. We want you to just be familiar with it because should you end up on one of these scenes and you do end up having contact with a patient, right, you're going to have to go through this procedure to get deconned, right? Understand that for the HAZTAC units, those guys are being deconned by their hazmat teams, by their what they call their SOC unit, which is their mass decon unit. And that's done generally at the hospital after the call. We've got a picture up here. This was the unit that transported the doc that went to Bellevue. And you can see the whole process that's involved. They established the hot zone and the clean zone. They decon the providers themselves. As you see it, they're helping them out of the coveralls. And in some parts of it, they actually cut the coveralls out around the provider just to prevent contamination, although that's not necessarily required. And they also ended up deconning the inside of the ambulance. I understand they used such a high concentration of bleach, they destroyed all the electronics in the ambulance. I'm sure operations loved.
But it was clean.
It was extra clean. And this is the same kind of process. We want, you guys don't have to know this inside out, but you do have to be aware that should you come in contact with one of these patients, this is the process you'll have to follow. For the most part, when you get on the scene, you're just going to follow the direction of the HAZTAC guys, and they'll have you follow them to the hospital.
As an FYI too, hazmat will decon everything that is on your person. If your wallet's on you, if your phone is on you, if your jewelry is on you, they will decon. I'm hazmat, so we're deconning everything that is on the person. So, I mean, we're told when we go through hazmat training, if it's valuable, don't keep it on your person if you're on a job. They tend to tell us not to keep anything in the front of the truck also, that we don't want to get decon. But just know that, like, if they start taking your jewelry off and stuff, you'll get it back, but it's just all going to get decon.
Yeah, it's probably not going to be in the same shape that you gave it to them.
Probably not.
Well, you shouldn't be wearing jewelry anyway, especially if you have the potential of putting on your PPE, that's one more thing that can interfere.
And obviously, guys, if we do end up with one of these calls, and please understand, we're not expecting you to get a lot of them. We're most likely, hopefully you won't get any of these patients. But should you will obviously want to notify your dispatch center when you get back to base, right? You want to run through everything with your agency leadership. If you do get some kind of exposure, follow your internal protocols on what you do when you get that exposure.
And you don't even need to write your own protocols. If you use the REMAX advisories that have gone out, put them in your operations manual, put them at your call receiving center, put it on the ambulance. It tells you exactly what you need to do, and that maintains compliance with the commissioner's order. Because that's one of the things you have to have. You have to have a plan in place on what to do.
And I'll just say beyond that, like if you do end up having contact with someone who turns out to be a confirmed case, you are going to be monitored for the 21 days by the city health department. And depending on the level of exposure that you had, like whether there was a breach of PPE, that type of stuff, you may have movement restrictions placed on you. If you have a high risk, a needle stick, some kind of like contact with bodily fluid without using personal protective equipment, like people who are in that position will probably end up being quarantined. So that's another emphasis to use the PPE when you're interacting with those patients. But even if you use a PPE, you're still going to be monitored, but that's going to involve like phone calls and stuff. It's just, you'll have an interview with someone from the city health department if you are in this situation. They'll assess what your risk was and like put you into the right monitoring program.
And also to let you know, not every hospital is set up to accept Ebola patients. There's Bellevue.
Yeah, so there are, in New York State, there are 10 hospitals that have been designated for the treatment of an Ebola patient. So there are 4 of them that are within the 5 boroughs of Bellevue, Mount Sinai, Montefiore, and New York Presbyterian, which is using the Allen Pavilion as the site where the person will be hospitalized. And then the North Shore system also has a designated hospital, that's at Glencoe, which is in Nassau County, so it's not in the city, but it's part of the network that overlaps with the city. And there are 5 other hospitals that are upstate.
Did they approve Staten Island University North?
So the hospitals that I just mentioned are specifically for the treatment for the duration of a hospitalized Ebola patient. For within the 5 boroughs of New York City, because we have this FT call type through our 911 system. We also have some other emergency departments that are prepared to accept the FT call type. That means that their emergency department has been evaluated by the state health department along with the city health department. Like, so they've been doing joint visits to assess their readiness. And they've also had a visit from FDNY to be able to accept, so that they know where the path is, where their hazard attack ambulance is gonna go, how the patient handoff is gonna happen, like that, if the ER is not gonna go on diversion and that sort of stuff. It has all been worked out ahead of time. So right now, actually not even all of the designated hospitals fall into that category that they're accepting FTs currently, because we haven't had the chance for FDNY to go and do their walkthrough and stuff. But so the hospitals that can accept the FT calls are Bellevue, Mount Sinai, and it was Staten Island University Hospital North, although I think that one might have briefly fallen off the list. That one is a little bit unclear, but we're actively working through to get more hospitals onto that list that can accept an FT call to the university
The
department.
take home here, now that you know those hospitals, is not just to show up at those hospitals.
Correct.
The most important thing to remember is that number has to be called, because a lot of things start happening in the background before anybody
Call
shows
the
up.
provider access line.
We're giving you that information that those hospitals are able to for your information, but please,
Yes.
it's not an invitation just to show up at a hospital.
Yeah, we're not encouraging you to perform any kind of transport for these patients. Once you identify the likelihood of having suspicion, you call the Department of Health number. It's up to you, their hashtag, and you just down up and you have to do it.
That's why they get paid the big bucks.
All right, guys.
We don't.
We got one question.
No, that was not good.
Question was answered. All right, so let's take a 5-minute break. In the meantime, Marie and I, we're gonna hand out some of these A60 coveralls. We have them here today. You're gonna be putting them on. So let's take a couple minutes break. Let's stretch. Right, get to the bathroom, get something to drink if you want to get something to drink. Get stuff, coffee, come back.